Next is the arterial supply. Okay, testicular artery arises from the abdominal aorta at the level of L2 vertebra. Okay, testicular artery at the level of L2 vertebra from the abdominal aorta. It arises. Venous plexus is through pampiniform plexus of veins, which drains into the pampiniform plexus drains from the testis, ascends up at the superficial inguinal ring, condenses to form 4. So pampiniform plexus, it goes above, superficially condenses to form 4 testicular veins, and then it condenses again to form 2, and then they drain each convert into 2 testicular veins. Okay, so one from right, one from left. So the right one drains into inferior vena cava, left one drains into left renal vein at right angles, at 90-degree angle. So varicocele, in this veins are dilated and tortuous. Okay, veins are dilated and tortuous. Now comes lymphatics. Lymphatics, it is drained into pre and para aortic lymph nodes. Now development of testis. The testis develops from the genital rich T10 segment. Descent of testis is more important. Develops in the abdominal cavity first. It develops in the abdominal cavity, and because there is increased temperature and no proper spermatogenesis, it has to descend down. So this is the reason of descent of testis, and that is how inguinal ring is formed. Okay, this descent occurs through the inguinal ring. Okay, so there is a fibromuscular gland band called gubernaculum testis, and there is processus vaginalis, which is the remnant of the peritoneal covering. Okay, now it first lies in the posterior abdominal wall at L to L3 vertebra in intrauterine life. Okay, so in intrauterine life at the level of L to L3 vertebra in the posterior abdominal wall it lies. Then comes processus vaginalis. It extends with testis. Okay, there is processus vaginalis. It extends with the testis. Now the descent of testis occurs. It reaches the iliac fossa in the 3rd month. Okay, in the 3rd month it reaches the iliac fossa. It reaches the deep inguinal ring in 4th to 6th month. The 3rd month it reaches to the iliac fossa. Okay, during intrauterine life, it is during intrauterine life beginning it is at the posterior abdominal wall at L3 vertebra. Iliac fossa, when the baby is still growing, is intrauterine life. At the 3rd month of intrauterine life, it reaches till the iliac fossa. In the 4th to 6th month, it reaches deep inguinal ring. 7th month, it reaches deep inguinal canal. Okay, 7th month, it reaches deep inguinal canal, and at the 8th month, it reaches superficial inguinal ring, and at the 9th month, it reaches till the upper part of the scrotum. Okay, till the it is entering into the scrotum, and till the base it reaches base of the scrotum, it reaches just before or just after birth. Okay, now factors, that is, there must be differential body wall growth, or there will be increased intra-abdominal pressure, which is causing it to descend downwards. Hormone action will be there. Okay, and then there will be contraction of gubernaculum. Cryptorchidism and ectopic testis, these are the 2 clinical correlation. Cryptorchidism, there is incomplete descent of the testis, so the testis is not descended properly, so it can get stuck. It can get growth can occur in the till the posterior abdominal wall, or it does not descend and it reaches till only iliac fossa, or it reaches up to deep inguinal ring or inguinal canal or superficial ring, or till the upper part of the scrotum. Okay, so till here these can be the incomplete descent, or the sites where the testis could lie in case of cryptorchidism. And then ectopic testis, this is mal descent of testis, that is, it has descended to some other region. From it can descend to the thigh region, or it can descend to the perineal region, or it can descend to the to the abdominal region somewhere else. So that is ectopic testis. Okay, thank you.